So what exactly is pelvic floor therapy? Well, I can tell you this, it is so much more than kegels. Kegels are a very small, sometimes even a non-existent part of what we do as therapists when it comes to pelvic floor therapy. Now, I'm gonna split this into two kind of realms here. I, of course, am a pelvic floor physical therapist, and then you also have pelvic floor occupational therapist. So I'm gonna talk briefly about each of them, but essentially starting from the PT standpoint, pelvic floor physical therapy is essentially when you go see a physical therapist that is specialized. They should have specialized training and continuing education that's specifically covering the pelvic floor, its anatomy, its function, etc. When you go see that individual, that professional, and they assess you, they do an initial evaluation, they take a look at how you're moving, posture, balance, strength, range of motion, etc. And they look at you from the outside, and they also look at you from the inside as well. So that is pelvic floor physical therapy. That's at least the start of the plan of care. As far as actual therapy, like, well, what is therapy itself? That is a range of things. So number one, I think the biggest thing that I do with my clients is I educate them. So I empower you with knowledge and education about what's normal. You know, how often should I be going to the bathroom? What should I do for the pain that I'm having after I tore at my perineum, after I gave birth? You know, and so education is going to be a huge piece. On top of that, of course, there is exercise. I would be remiss if I didn't mention therapeutic exercise in therapy. So that is something huge. One of the greatest ways to see permanent change is through that physiological effect that it takes place in our bodies when we load our tissue. So what I mean by that is when we put our bodies under a little bit of stress, for example, for strengthening exercises, our bodies respond to that. And then from there, that actually can change the function of how we're living from day-to-day life. So for example, if you are leaking, let's say, with coughing, laughing, and sneezing, and your pelvic floor really does need that beefing up, you know, that strengthening there, then your therapist may include, or hopefully should include, some type of a strengthening program for your pelvic floor, but for the surrounding muscles as well. So your hips, your back, your quads, your glutes, you know, your spine, all of that. So far we've got education, we have exercise. The next one that I would like to talk about is manual therapy. So this is hands-on therapy. This can be a couple of different forms. This can be literally a little bit of soft tissue work, so that can be considered massage, skin rolling. Of course, there's things like cupping, dry needling. Some therapists do perform manipulations, which are otherwise known as adjustments, like for example, what chiropractors do. There are physical therapists that are trained and know exactly how to do those manipulations as well. So that's all hands-on therapy, manual therapy. The next thing I'd like to talk about is something that it's got a fancy term, but it's called neuromuscular re-education. And what that means, it's simply retraining your muscles so that they become more coordinated, they become a little bit stronger, or perhaps they actually get more relaxation in through those muscles. So it's just a retraining of your muscles and your whole body as a system as a whole, your nervous system and how it connects to your muscles. Of course, there's also therapeutic activities, which that just simply means functional day-to-day activities. So let's say you're a mom and you want to pick your baby up out of their stroller without hurting your back. Well, your therapist absolutely should look at that with you and should guide you and give you those tips and tricks to really align yourself properly so that you don't have to worry about, messing up or throwing out your back. Or for example, one that I do all the time is work on moms on like putting their baby inside the car seat inside of their car, or taking the baby out of the car seat, once they arrive at their destination. So we go over body mechanics and ergonomics and all these different things. Essentially, that kind of covers the gist. I'm probably forgetting something here. So if you're a therapist, especially a pelvic floor therapist, and you're watching this, I apologize, I'm probably missing something, but that's the gist of therapy. So it kind of covers a broad spectrum of things. Another really important piece to what I do, particularly as a pelvic floor physical therapist, is take the time to listen. So listening to my clientele, and what that means is simply allowing them that space, holding that space for them as they share some really, really important and oftentimes very, very deep things with me. And so I would encourage you, if you are looking for a pelvic floor therapist, make sure that you find someone that makes you feel safe, that gives you that space to express those things. And yes, sometimes it takes a few sessions to build that trust and to build that rapport, but having a safe space for your therapy sessions with something that's so intimate and private is so, so important. So that is basically what pelvic floor physical therapy is. Just to kind of touch on, how many sessions do I need, or how long does this take? It varies so widely. And the reason why I say that is because oftentimes I see people that literally it takes them just a few visits. Like, what I mean is like maybe 2-3 visits if they're having a very minor issue, and it goes away just like that. Other times it takes a little bit longer, especially if someone has been having something that's very chronic, years, 10, 15, 20 years, that can take a little longer. So that might be something consisting of a few months in therapy, meeting maybe every week or maybe every other week from there. Essentially that is the plan of care, and the plan of care varies from person to person. So you and your physical therapist or your occupational therapist should have a conversation about what that looks like and kind of how long you are expecting to be in therapy for. And one last thing, I have to mention this, if you go and see a pelvic floor therapist, I would highly, highly, highly recommend you find a therapist that is well versed in what we call orthopedics and in the pelvic floor. What I mean by that is, for myself, for example, I'm a physical therapist. I have experience in orthopedics, meaning I know how to treat, shoulder pain or knee pain or foot or neck or whatever it is, right? Just any type of joint in the body, essentially, that is attached to muscle. I know how to work on that and how to address it and treat that issue. And so it's important that you find someone that knows how to do this, because the reason is because the pelvic floor does not act in isolation. And sometimes certain pelvic floor therapists, they zoom in really, really close to the pelvic floor and they kind of stay in that little box, but they can miss sometimes key things that are happening outside of the pelvis. So in the chest, in the thoracic spine, the diaphragm, even, the knees or the hips or even the foot sometimes. So that would be my last little recommendation for you. If you are going to see a therapist, make sure you find someone that knows how to treat the whole body and the pelvic floor, because that is how you will get the best results. I hope you enjoyed today's video. Stay tuned for the next one.